I think they have gotten the whole notion of how do we better align the incentives of the entire healthcare system. And so I think that clearly that is showing signs of progress. I would say the second thing is the incentives around focusing on health and looking at the holistic person is clearly headed in the right direction. And then lastly, I would say we are beginning to focus much more on outcomes as opposed to process. And so value-based care and value-based payments around that is starting to get us to talk in the industry much more about outcomes of care as opposed to just procedures. And I think those are all very good signs. Clearly, it's the affordability issue that the new payment programs are all headed in the right direction, but at the end of the day, from all walks of life, we hear people talking about how unaffordable healthcare is. And so that is still the major issue that we have to continue to solve to. Well, the healthcare industry is still very fragmented. It's siloed. You have pieces of the industry that still work within itself, the hospital part, the physician groups, the labs. And so what still needs to happen is how do we better integrate and look across the whole process of care and care delivery. And that is going to continue to require us to work together to figure out how to pull all the pieces together. And, my view is in the future, it will look more and more, quite frankly, like the Kaiser Permanente model, in which all the pieces are brought together and we are able to provide the longitudinal care because we cover all the pieces inside of Kaiser Permanente.